muscles. Anterior muscles of pelvic girdle are musculus psoas major. It starts from lumbar vertebra, from bodies and transverse processes of lumbar vertebra, and goes downward, and inferiorly it's joined with the next muscle. This iliac fossa, it has musculus iliacus, and iliac muscle together with psoas major combine together and forms iliopsoas muscle. This muscle is iliopsoas, and iliopsoas muscle attach in the region of lesser trochanter minor. Function: flexion in hip joint and supination. Sometimes we can find musculus psoas minor, but here it is, this muscle is absent. It also starts from lumbar vertebra and attach in the region of pubic symphysis, in the region of fascia iliaca, and it moves, participate in flexion of lumbar department of vertebral column. They are anterior muscles of pelvic girdle. Impossible to see in posters, but here it is. We can see a muscle, musculus tensor fasciae lata. This muscle starts from iliac bone, and tendon of this muscle attached to fascia. Fascia of the thigh has name fasciae lata, and tendon of muscle it attached to, fused with fascia, makes tractus iliotibialis, and tractus iliotibialis goes to lateral condyle of tibia and head of the fibula, tractus iliotibialis. This muscle participates in flexion in hip joint and flexion in knee joint. Now, muscles of the thigh. Muscles of the thigh consist of anterior muscles, here it is, medial muscles, and posterior muscles. Anterior. In anterior group, we can see sartorius muscle, musculus sartorius. This muscle starts from spina iliac anterior superior and attach in the region of medial condyle and tuberositas tibia. Function: flexion in hip joint, flexion in knee joint, and lateral rotation of thigh. Next, quadriceps, musculus quadriceps femoris, hold this muscle. And quadriceps consists of 4 muscles. This is musculus rectus femoris. Rectus femoris muscle starts from spina iliac anterior inferior, then musculus vastus medialis, then musculus vastus lateralis, and between them musculus vastus intermedius. These 3 vastus muscles and rectus femoris together makes quadriceps, and quadriceps, tendon of quadriceps surround patella and attach in the region of tuberositas tibia. Main function of quadriceps, that is extension in knee joint, and musculus rectus only, rectus femoris, the same, participate in flexion in hip joint. They are anterior muscles. Now, medial muscles of the thigh. First of all, here it is pectineus muscle, musculus pectineus. It starts from ramus superior ossis pubis and attach in the linea pectinea of the femur. Function: adduction in hip joint and flexion in hip joint. Next, 3 adductor muscles, musculus adductor longus. Next, musculus adductor brevis, long, short, and large, musculus adductor magnus. 3 adductors muscles. They start from pubic bone and attach in the region of linea aspera on the femur. Function, all of them participate in adduction, it is clear, because name of these muscles, musculus adductor. Adduction in hip joint, and long and short muscle, the same participate in flexion, and large muscle, musculus adductor magnus, it participate also in extension in hip joint. And last medial muscle, that is thin muscle, musculus gracilis. Musculus gracilis. Start from inferior ramus inferior ossis pubis and attach in the region of medial condyle and tuberositas tibiae. Function, adduction, flexion in hip and flexion in knee joint. Posterior muscles I will explain in a minute, and now some words about topography. Below of inguinal ligament, that is inguinal ligament, what is it? This is superficial inguinal ring, and now my forceps were in inguinal canal, and that is spermatic cord. That here it is testis, that is a testis, that is spermatic cord, and spermatic cord goes to inguinal canal. Below of inguinal canal, all of this space separates into two halves. Laterally, we have lacuna musculorum, and medially lacuna vasorum. Lacuna musculorum and lacuna vasorum separates one from another with the help of arcus iliopectinus. Arcus iliopectinus, that is a border between them. And musculus iliopsoas, it passes through lacuna musculorum, the same like femoral nerve, and vessels, here it is femoral vein, and this one is femoral artery. These two vessels pass through lacuna vasorum, and medial angle, here it is, medial angle of lacuna vasorum, that is femoral ring. Annulus femoralis, anterior wall of femoral ring, that is inguinal ligament. Medial wall, that is lacunar ligament. Posterior wall, here it is, pectineal ligament, 3 ligaments, and laterally femoral vein. They are walls of femoral ring, and sometimes through this femoral ring, femoral hernia from abdominal cavity goes to thigh. In this case, femoral ring, that is inlet of femoral canal, and outlet, that is opening in fascia lata. You should remember that femoral canal in normal is absent. We have not got femoral canal. Only we have femoral ring, and fascia lata has superficial and deep layer. And superficial layer of fascia lata, it has hiatus saphenus, that is place where vena saphena magna, this vein, insert into femoral vein. It passes through hiatus saphenus. This hiatus saphenus, that is opening where? In superficial layer of fascia lata. And in time of femoral hernia, femoral ring, that is inlet of femoral canal, and hiatus saphenus, that is outlet of femoral canal. And femoral canal has 3 walls. Anterior wall, that is superficial layer of fascia lata, or it has named this part of superficial layer which is fused with inguinal ligament, that is superior horn, cornu superior. Then posterior wall, that is deep layer, here it is, all of these muscles closed with a deep layer of fascia lata, it is posterior wall, and lateral wall, femoral vein, 3 walls. Anteriorly, that is superior horn, cornu superior, that is part of superficial layer of fascia lata. Posterior wall, deep layer of fascia lata, and lateral wall, femoral vein. What else? Femoral triangle, that is superior wall, inguinal ligament, lateral wall, who remember what is this muscle? Sartorius muscle, and medial wall that is musculus adductor longus. And this femoral triangle has two grooves. First groove, that is groove between musculus pectinus and musculus iliopsoas, and name of this groove, that is sulcus iliopectinus. And sulcus iliopectinus continues into sulcus femoralis anterior. Sulcus femoralis anterior is between musculus adductor longus and musculus vastus medialis. And this groove continues in lower third into canalis adductorius. Canalis adductorius, it present always. Everybody has canalis adductorius. Femoral canal only when? Who has femoral canal? Only who have femoral hernia. In normal, femoral canal is absent, but canalis adductorius present in normal, and this canal has three walls. Medial wall, that is adductor magnus, lateral wall, that is musculus vastus medialis, and anterior wall, that is lamina vasto adductoria. Lamina vasta adductoria, that is a part of fasciae lata which start from musculus adductor magnus and goes to musculus vastus medialis. That is why it has name lamina vasto adductoria. Now we move curve on posterior surface.